Hi, Healthy Fam. Welcome to another episode of My Health Matters. Said something in our last episode that we have something special coming. We've had it in the pipeline since, but now it is coming into reality. And what is that? You're going to find out soon. As part of cardiovascular system that we have for today, though we talked about heart last week, but it's not just the heart that comprises of the cardiovascular system. We have the blood and the blood vessels, and we are going deeper into the blood today. What is that special thing? It is a professional interview where we bring professionals on the show. They share their personal experiences and the focus of the month, a particular organ of the month that is their specialty. They shed more light on it for us. So today we have a special guest on this show who is a research nurse in hematology. She's going to be shedding more light on blood cancers or anything related to blood. So grab a chair and let the show begin.
My name is Tolulokpe Ayodele. I'm a registered nurse since 2016. Currently, I work as a clinical research nurse and I specialize in hematological conditions, which we commonly know as blood cancers. And examples of blood cancer include myeloma, leukemia, lymphoma, amongst others. I love my role because it allows me to educate and support patients having blood cancers. It allows me to support patients going through clinical trials for their blood cancers. At the long run, we get new treatments, new therapy that is useful for the patient and for the future. What are blood cancers? Just like normal blood cell types to be red blood cell, white blood cell, and platelet. Blood cancer occurs when there's proliferation of this blood cell. What that means is there's overproduction of these red cells. For example, if red cell is supposed to produce like 10 in a day, and then there's like a geometric progression of producing like 1,000 bloods in a day. So the blood vessels can't handle it anymore, the organs in the body can't handle it anymore. So there's overproduction of red blood cell, overproduction of white blood cell, and because of this there's bleeding because the body is being bruised. And there's bruising, bleeding, there's joint pain, there's swelling in the body, there's fever. And that is why these symptoms can count as normal in the life of somebody growing. They can just see it as a normal way, normal sign of aging. I'm having bone pain, I'm having fever, I'm having all this. And when they go to the hospital, the blood result shows that they might be having blood cancer. So that's a little bit idea of what blood cancer is all about. And we have about 100 types of blood cancers, but the most common one is myeloma, lymphoma, and leukemia. I think we've talked about my role in the first question, so I won't talk too much about it. Some of the things people are surprised about breast cancer is number one, most of the blood cancers are very slow progressive. Medication is not a death sentence. Sometimes it takes a while. The growth process is very slow. They call some cancers watch and wait. So patient comes to the hospital, they check their bloods, and once it's okay, they send them home. So they watch and wait until the blood count is severe or is significant, and they start treatment. Another thing is blood cancer is actually very common. It's the fifth most common type of cancers, but it's not very popular. But it's really prevalent these days, but most people don't really know about it. Another thing is detected by accident. For example, most people get their diagnosis by accident. Maybe they came in for blood, so they have some other conditions, and then they take their blood and then they discover they have blood cancer. So it's mostly common in most of my patients. They detect it by accident. Just like I said, it's not a death sentence as well, unlike what people think of. Advice I would give to someone looking to go into hematology, maybe as a hematology research nurse or as a hematology nurse in the ward, or even advanced careers in hematology, would be it's a lifelong process of continuous learning. Even blood cancers itself, still getting research about it. So everyone needs to learn. You have to refresh your mind about it. Secondly, on the emotional side, Patients having blood cancers are going through a tough time in their life, emotionally, in every aspect of their life. So it's important to gain connection with this patient, to be able to relate with them, even as a nurse, to have emotional stability as well, so you can support this patient. Trends that you may need going to hematology might be attention to details. We deal with blood results. Every unit matters, every blood result matters, so it's very important to pay good attention to details. Someone going through blood cancer this time, I'll just say that give yourself grace. It's a very difficult time, but you don't have to be strong all the time. Give yourself time to rest, to talk to people you're close with, to not burden everything to your heart, because stress itself, not sleeping and having lots of sleepless nights, restlessness, can cause more harm than the diagnosis itself. So show yourself lots of grace and have quality time with family. Life is a gift, that's what I would say, and enjoy this gift of life. And if there's any medication, any therapy, if it's something that speaks to you, go for it. Or if there's any medical, clinical trials or treatment ongoing, it would be wonderful as well. I would say this field, this career has showed me to show grace to people, to always be patient with people. I don't know what individual is passing through. Many people are living healthy, even going out, we meet them everywhere, but they're going through a lot. They're having so many diagnoses their head can't handle, their brain can't handle. We just have to show grace to people, and then, care for patient, care for them as if we have our loved ones on the bed. That's what I do when I go to see my patient in the day unit or whatever in the ward. I take care of them. I speak to them as I would speak to someone I really love very much, someone that is close to me, and care for them, not because it's just part of the job. Because if you care for a patient like, oh, it's just my job, I have to do my job, they will know. But if you care for them because it is what you do, and that you care about the role you're doing, and that you are there for them, they will own up to you, they will speak to you, so that you'll be able to get them better help. I think that's the advice.
Who enjoyed that interview? Drop in the comment section one thing that stood out for you, one thing that you have learned that will not leave you as you leave the show today. Thank you very much to our very special guest, my friend Oremi. Thank you so much for honoring to be on our show today. We really learned a lot. Thank you for sharing your personal journey with us. Thank you for giving us professional insight, professional advice. We do not take this for granted. And to our community members, LD family, I hope you've gained one or two insights from the show today. You understood better blood health and the importance of early awareness. If you notice any unusual symptoms, please seek medical advice early. Importance and emphasis on early. It saves a lot. Don't wait till it becomes too bad. Seek medical advice early. And if you are navigating any of the diagnoses that has been mentioned or anyone that wasn't mentioned, please extend grace to yourself, just like our special guest have said. Thank you for being a part of My Health Matters. See you again on Friday, where we'll be having a reflection of the month. Bye.